Here are the 4 causes of sciatica. When we talk about sciatica, it's a nerve that runs through this spot right here on the bone, and it goes into the back of the hip, back of the knee, down the thigh, down the lower leg, and it even goes, the same nerve goes into the heel and all the way to the toes. And it starts not just right here, but it comes, the big nerve that pops out right here comes together from the nerves in the spine. And so we're going to start from top to bottom, and I'm going to talk to you about how a lot of people are getting surgery in the spine unnecessarily because they're missing the other 4 causes or not addressing those and jumping to the first one. If you get a pinched nerve up here in your lower back, if a disc becomes herniated and presses on the nerve, or if you get something called stenosis where the openings for the nerves to come out of the spine here start to shrink, that would be foraminal stenosis, or sometimes you get stenosis in the middle within the spine, that would be central stenosis. If you pinch nerves up here, it can present as symptoms down the back of the leg, the back of the butt area, the back of the glutes, into the hamstring. All these muscles can be affected, and you might get pain all the way down into your lower leg. It can be coming from there. Absolutely, that could be the problem. If you have an MRI and they find a herniated disc or stenosis, that may be 1 out of 4 things. My issue with people getting treatment at this point is they haven't investigated the other 3 issues, and one of those other 3 issues might be the bigger problem than the herniation in the spine. And sometimes people are even getting a discectomy, a surgery where they're cutting out a chunk of the disc that's herniated unnecessarily, and then they'll still end up with sciatica problems later on after the surgery, and it would be a failed surgery at that point. Number 2, the second most common area to get affected from sciatica, cause of sciatica, is a shift in this pelvis bone. These bones right here that look like butterfly wings and they attach to the tailbone right here, they come together at the front. This is called the pubic bone area right here. If you have weaknesses in certain muscles, the glutes usually, because the glutes come in and attach over the joints between the tailbone and these bones right here, it might allow these bones to shift. They can actually shift upwards, downwards, they can fan inwards, fan outwards, they can even rotate. There's a bunch of little motions, and this is kind of controversial in the medical field. Some people think that they don't shift, but I've done treatments where I realign the position of this and it magically gets better. And it's, I mean, I say magically, but I know what I'm doing. I'm shifting a bone in position. And if you think about where the sciatic nerve comes out right here, if this bone is shifted forward, for instance, like it's rotated forward, the edge of this bone is going to compress the nerve right there. And so if we get this bone to shift backwards into the correct alignment, then you can decompress the nerve and have an experience where you have magical relief. Now, the techniques that we use to shift the pelvic bones and correct what we call SI joint dysfunctions, sacroiliac joint dysfunctions, they're short-lived. It's really a short-term solution, because if you don't fix the underlying root muscle imbalance, which is usually a combination of glute weakness and abdominal weakness on the front, then that bone's going to shift again and put pressure on the nerve again eventually. So it's a short-term solution. You have to get stronger in the right areas to keep the bone in the right alignment. The third cause is that same nerve, the sciatic nerve that pops out right here. It's on the back of the hip joint. If you have that weakness of glute muscle weakness, that muscle attaches from these edges right here and then fans out and comes together to attach to the outside of the hip bone right here. And you have some deeper muscles right here, one of those being the piriformis muscle and some other glute muscles. Usually they all kind of get weak together. If they're weak, one of their jobs is to rotate the hip backwards, so this movement right here, to put the right tension and alignment through the hip joint and control the leg. But if they're weak, then there'll be a tendency for that bone to rotate forward because these muscles lengthen. When that bone rotates forward, it stretches the attachment points for the glute muscles, which then can compress the nerve here as well. So you might not get not only a compression from the bone here, but now the muscles are getting overstretched and compressing the sciatic nerve right here. And that would be very in line with what's called piriformis syndrome, which is debatable on whether or not it's just the piriformis, just because there's so many muscles in the area that could get weak, but very often piriformis gets blamed because its position is right over the sciatic nerve. But when I look at patients, I'm telling them just strengthen everything. Don't worry about the piriformis, it'll get stronger too. But if you get all the glute muscles stronger, you'll do this and take tension off the area. When you get this position of the hip joint because of those weak muscles, because this bone is all together, the thigh bone, if it rotates forward, you can see it changes the position of the knee as well. And so you get this combined tension up here, and then the nerve runs down the back of the leg, and it can put some bad tension on the nerve down at the knee joint. And so we're talking about the knee joint. This would be the right knee. The knee will cave inwards. When you have that rotation inwards, it can cause the knee to cave inwards and put excessive tension on the nerve at the knee. So you get two tension points that develop on the sciatic nerve pathway as a result of that glute weakness up behind the hip. When you have that alignment problem in your thigh bone happen, it sets up the fourth problem all the way down here at your foot and ankle. Because that sciatic nerve, it changes names because it eventually becomes the tibial nerve on the back of the knee, down the leg, and then it becomes a plantar nerve on the bottom of the foot. But it's the same pathway. You can trace the nerve all the way down from the spine through the sciatic nerve all the way down in here. But that nerve ends up passing right here on the back of the heel in this space, and then it splits into different directions. One of those goes into the heel area. They call it Baxter's nerve. That nerve is right at the base of the plantar fascia. And when that nerve gets irritated as a result of this whole sciatica process that I'm describing to you, all these causes of sciatica, it can often be mistaken for plantar fasciitis. In fact, from my experience, 9 out of 10 people that come in with plantar fasciitis as a diagnosis, 9 of them don't have true plantar fasciitis. They have an irritated sciatic nerve that's presenting as an irritated nerve here at the heel, and we treat it by treating their sciatica, and the heel gets better. It's not true plantar fasciitis most of the time. You can also get pain in the arch of the foot and all the way into the toes because those same nerves go to the tips of your toes. And what happens here is if you get weakness in toe flexor muscles that help to support the arch of the foot, the ankle will start to collapse inwards and the nerves run here, and so it also puts tension on the inner part of the ankle. And then if the arch collapses down, by flattening the arch, you put tension on the nerve too. So now think of this concept of nerve tension. Nerves aren't supposed to be tension. Nerves move in your body, right? Every time you move your arms and your legs, there's nerves within there that have to move with your hands and feet and arms and legs. And they have a normal amount of movement that they can tolerate, but when they become irritated because they're being compressed up in the spine, compressed here, tension at the knee, tension at the ankle, down into the arch of the foot, all these tension points can build up and then cause multiple stretch points, multiple pressure points along the nerve pathway and set up severe chronic sciatica. You can do stretches, you can do massages, you can look at pain medications, injections. There's things you can look out to try for, but all that is just going to be short term. Even adjusting the bones, getting the joints freed up. What needs to happen is we need to get stronger in 3 key muscle groups. The 3 key muscle groups are going to be the lower abdominals, then the glutes in the back of the hip, and the last one's going to be the toe flexors in the feet. The reason for this is because, I'm going to tie back to the causes. If you get the lower abdominals stronger, it fixes an imbalance where those lower, I'm talking about like the rectus abdominis muscles, the six-pack muscles, they attach to the pubic bone right here. If those muscles get stronger, they'll put into balance the muscles around the spine, because when they're weak, the muscles in the back of the spine here start to take over to provide stability and movement for the lower back. But if these muscles are grabbing too much, it's going to compress the spine and put pressure on the discs and close the holes. That's what can contribute to stenosis. And that pinches these nerves up here. But if you get stronger abs, it balances out the pressure and puts the normal amount of pressure through the discs and in the holes for the nerves to go through. Not only that, but those lower abs will help tilt the pelvis backwards. We call it a posterior pelvic tilt. There's a lot of research behind it and how helpful it is for back problems, but also for sciatica problems. When you tilt that pelvis backwards, it puts the glutes in a good position to work. If the glutes are working good, then they're going to give stability to the SI joints. That's going to keep you from shifting these bones around and putting that bad pressure on the nerve where it pops out of this little hole right here. Then if your glutes are working well, it's going to pull your thigh bones, your femurs, into the right position so that you're not over-tensioning the sciatic nerve back here. And if your thighs are in the right position, then it's going to keep your knees aligned properly so they're not caving in and putting bad tension to the knees down here. And if your knees are aligned properly, then it's going to keep your ankle aligned properly so it's not caving in at the ankle and stretching the nerves here, and your arch isn't flattening out so that you're not over-tensioning the nerves down here. That's going to help. The toe strength is going to help with that. If you have good toe strength, it helps to raise your arch into the normal position, helps to align your ankle into the normal position, and contributes to keeping your knee in the right alignment. So all these three muscle groups work together, the glutes, the lower abdominals, and the toe flexors, to keep proper alignment and support and good joint position throughout the entire length from your lower back all the way down to your toes. That is how you fix sciatica long term. Get stronger in those three muscle groups, and you'll be fixing the root muscle imbalances that are setting up bad tension and bad pressures through your sciatic nerve. If you want to know what not to do if you have sciatica pain, check out this video right here. It's called The Worst 10 Mistakes People Make When Trying to Help Sciatica Pain.